say, little darling, it seems like a year since it's been here. Here comes the sun, here comes the sun, I say.
The sun is certainly shining in Dublin today.
I suppose everybody, Botox, it's world famous. Everybody has heard about it, even if they don't know exactly what it is. We're going to talk a little bit about that.
Sure, absolutely. Certainly, if penicillin, I think, was the wonder drug of the 20th century, Botox certainly is the wonder drug of the 21st century. And Botox was one of these compounds, I suppose, that started off in the red top journal with all the potential side effects it could have. A bit like mobile phones, I suppose, started off with the potential for brain cancer, but in both sort of instances nothing ever happened. And in many ways it gave Botox such a worldwide platform. This really is a phenomenal drug. Botox, I suppose, now is used this morning probably in Crumlin Hospital, in Tala Hospital, young children with cerebral palsy, but right across the board. I mean, it started its life as a drug used in blepharospasm, that sort of tic that people get where they continually sort of contract their eyes all the time.
Yeah.
And when ophthalmic surgeons used it for this reason, Jean Carruthers, a friend of mine in Vancouver, was actually the first person, or among the first, that turned around and realised her patients were all coming into her saying, "Hi, my wrinkles are all disappearing." So she turned to Alistair, her husband, who was a dermatologist, and of course the world phenomenon that sort of happened in 1992 has given rise to cosmetic clinics around the world. But I suppose if we look at the other uses of it, Botox is also used, as we know, for sweating, which we know as axillary hyperhidrosis. It's used for squints in young children for strabismus. It's used for migraine, other headache disorders, and right across the board, pediatric incontinence, neurogenic bladders, anal fissures, diabetic neuropathies, wound healing. It's just incredible.
So it's very, very widespread. But what about now? Is it a myth, or is it true that it is effectively a form of poison?
Right. Well, it is a chemical that's produced by a bacteria. What we got to look at is, what does a toxin mean? A toxin means a chemical, if we're given a strong enough quantity or concentration, can kill somebody. So then we have a thing we call a therapeutic to toxic ratio. Most of the best drugs we have in the world are all toxins. If you go into St. Vincent's Hospital this evening with a cardiac arrest, you're going to get lignocaine, atropine, digitoxin, digoxin, and all these are side effect products of plants, or some of them started their life sort of in blowpipes with South American Indians, as in all the canes, the cocaines, the atropines. So if we look at digoxin, for instance, it's been around since 1666. A very common drug used sort of cardiac-wise. The therapeutic to toxic ratio of digoxin is only 2.4 to 1. So in other words, if you can overdose very quickly. People in Ireland, let's say in Bray this evening, that are mixing up the tablets, could become toxic. The therapeutic toxic ratio of Botox is 60 to 1. So we would really have to go out of our way. We give about 50 units, and for it to cause systemic side effects of the ratio that we're talking about, you'd really need 3,000 units.
Okay.
So, I mean, the safety profile of Botox is phenomenal.
So despite what's being said, which may be true, it would need to be taken in huge quantities.
Absolutely.
Yeah, okay. And what about some of the side effects? What are the risks?
Sure, well, the side effects actually are fairly minimal, believe it or not, in the right hands. They're usually minor and generally quite temporary. We can split these into two different types. One is paralysis of the wrong muscles, and the other is allergic reactions. Now, it's fair to say bruising is probably the fault of the person who's doing it rather than Botox itself. So we'll leave bruising to one side. Let's say if we have somebody who injects the wrong muscle groups, you can get inappropriate facial expressions such as drooping eyelids, double vision, uneven smiles, or even the inability to close eyes at times. These are very rare, probably in the ratio of about 1 in 650. And usually they'll wear off in about 6 weeks' time. The duration of Botox itself, as we know, lasts between sort of 4 to 6 months. And other minor adverse effects that we don't tend to see very often, but certainly we know they run the ratio about 1%, are headaches, flu-like symptoms, possibly blurred vision, dried mouth, fatigue, those type of things. The sort of people, I suppose, who shouldn't get injected are very sort of, rare, far between as well. Normally we wouldn't inject pregnant women, but having said that, if a pregnant woman got injected, there's no evidence that it causes any problem. And we know that because most of the people who get it are females within childbearing age. And of the, I don't know, I think there's something like 25 million scripts that have been used worldwide. About 1 million of these people have become pregnant without any evidence of any adverse side effects. People who have allergies to eggs usually are also told not to use it because I think some of the strain is probably grown on sort of egg yolk. And then some neuromuscular disorders, very strange, rare, myasthenia gravis or Eaton-Lambert syndrome. Usually these people are advised not to use it also. Now it's funny that we mentioned that. I had one patient who came in to me after 3 different times and said, Patrick, it's incredible what you can do with the Botox because it's the only thing that has ever been helpful in keeping my eyes secondary to my myasthenia gravis. And I'd let it slip through the net. So you can even see with MG is not even a contraindication. Used appropriately, it probably can, in some way, it is, even though that wouldn't be the correct advice to give normally.
Well, that's a very, detailed medical view on it, but sure. I suppose most people's knowledge of it, and maybe even interest in it, is from a cosmetic point of view.
Sure.
And does that show any signs of abating, even in these recessionary times?
Probably going up a little bit, as people sort of defer from having more complex procedures to ones that are sort of less expensive. No, there's no doubt about it. Botox and I think cosmetics will go hand in hand for a long time yet. It's very good at, number one, taking away frown lines, then sort of lines in the forehead, and third, probably lines around the crow's feet. And it's one of those, I think, medicines that probably, it has been around now for so long, probably certainly 14 or 15 years without any evidence of sort of problems or minimal problems, and I think it'll probably go into the next century the same way as it has entered this one, as something that is almost part and parcel of growing older. I don't want to trivialize it, but I mean, a lot
Sure.
of people will tell you almost like they get some sort of a high from using Botox, almost similar to the way that if they go and get highlights in their hair. And we've looked at this. And
so it's a psychological...
Well, we think it happens a slightly different way, believe it or not, Sean. If you have got a situation where you're frowning all the time, you send these negative sort of pathways back to your brain and telling your brain all the time sort of, I'm stressed out, I'm not feeling good, sort of I'm cross. And if you block those signals, the pleasure signals in your brain apparently can take over. A bit like the sun going down at night time and us being able to see the stars. But I mean, not only is that a theory that has been put out there, but people have tried to patent Botox for depression, and certainly the physiological pathways involved in that sort of phenomenon have already been accepted medically.
It's an interesting angle, one you don't hear that often. You mentioned earlier about about I suppose how long it lasts, 4 to 6 months or so.
Well, people should also know, I suppose, there's different types of Botox out there. They're largely split into Allergan, which is made by, I suppose, the American Defence Forces, started off in Fort Detrick, and then Dysport, which is made in Britain, in Portland Down. So both of these compounds started their life back 1918 to 1940, being used by the US and the British military.
And what were they using it for?
Well, we know that Botox is one of the most toxic substances on the planet and can be used in terms of chemical warfare. It was used, we think, by the British agents in 1944 to kill some Nazi sort of high-ranking officers in Czechoslovakia.
Right.
And I think also, certainly, Saddam Hussein had it among his armoury. So there's no doubt about it. I suppose in vast concentrations it could have a potential military benefit to some nations. In terms of the different types also, the licensed brands of Dysport have become a new compound now called Azzalure, and the licensed brands of Allergan have it's become a new compound called Vistabel. So when patients go into their different clinics now, they may be approaching these names for the first time. So as long as they know that most products, Dysport or Allergan's form of Botox, seem to be pretty similar, I tend to prefer to use Dysport. In my sort of experience, it seems to last longer and give a better effect. I certainly have nothing against people using Botox also, but people who are, I suppose, proceduralists tend to have their own preferences in which to use. And then we normally use Botox off-label, sort of in a lot of different wide areas. But certainly there is a license for Botox in the central frown area, both in Britain, Ireland and the United States, and the compound that's used for that is Azzalure. Now, Azzalure probably be launched in Ireland in a bigger way within the next few months, and Vistabel, who is, I suppose, Botox's form, has been here for quite a little while. So just in case patients get confused, it has come all under the general name of Botox per se.
It all sounds quite detailed, actually.
I'm sorry I didn't make that, yeah.
But, if you're going down the road of Botox injections, and you presumably, the results are fairly immediate.
Usually Botox will kick in between 2 to 5 days.
Okay,
Dysport will. Botox itself from Allergan kicks in a little longer. It can take up to, some people say, 10 days to kick in. And then the effects last between 4 and 6 months, depending on which compound you've used and probably your own reaction to it.
And if somebody is, let's say, a fan of Botox and a fan of its effects, is it something that needs to be done twice a year? Is that the standard view?
Yeah, twice a year, possibly 3 times a year in some instances, if patients are getting about 4 months out of it. But yeah. Most people would do it probably twice to 3 times a year. Mm-hmm.
Okay, and showing no signs of dropping in popularity, the opposite of anything.
Botox and derma fillers have been 2 of the sort of cosmetic medicine procedures that have certainly held their own in recessionary times. And also, I suppose, as patients cut back from cosmetic surgery per se, facelifts and anterior neck lifts, platysmal lifts, all the more sort of complex procedures, they certainly will still try to preserve their good looks and their interaction and keep out the bright side, and Botox and derma fillers seem to be holding their own.
Very good. Interesting stuff. Thanks very much for joining us again this morning. Also,
yeah.
And if you pardon the pun, filling us in. Thanks very much. That's Dr. Patrick Treacy from the Aylesbury Clinic, and now you know just about everything you probably ever wanted to know about Botox.
Since we'll be doing things Europe's way for a while, Galway's decided to make like Budapest, Frankfurt and Vienna.